God,
grant me the serenity
to accept the things I cannot change,
the courage to change the things I can,
and the wisdom to know the difference.
In this edition of Malden Overcoming Addiction, from Cataldo Ambulance, EMT and Clinical Educator Andrea Ball will demonstrate the proper way to administer Narcan. Together we can make a difference. Here's your host, Paul Hammersley.
Welcome to another episode of Overcoming Addiction. My name is Paul Hammersley. I'm the president of Malden Overcoming Addiction. And I have a very special guest here tonight, Paramedic and Clinical Educator Andrea Ball from Cataldo Ambulance, and she's going to show us how to administer Narcan. Andrea, how are you?
Well, how are you, sir?
I'm doing all right. So tell us why we're here. Tell us, maybe lead us into what's going on out there and why we asked you to come on, and maybe the problems we're seeing right now in the communities around us and our own community right here in Malden, and how we can help.
Absolutely. First and foremost, thank you for having me here. This is a topic very near and dear to everybody in the EMS field. Overdoses from the opioid and pain medications, as well as heroin, is taking lives every single day. And this is one thing where we can actually do to help. Being able to properly administer Narcan to an individual we do believe to be overdosing is paramount in absolutely saving lives every day.
Absolutely.
That's what we're here.
So right now, you guys, roughly, how many calls do you think you might get? Like, could you give me a weekly amount, or that could be overdose related or opioid related, weekly? What's happening with the calls?
So I can only give you based upon just very rough data.
Yeah, that's fine.
In terms of actually confirming an overdose, that's done at the hospital. But I can guarantee that system-wide, so we cover everything from northern Massachusetts all the way down as far south as Wellesley. So we can get anywhere between 10 to 12 calls a day. A day for suspected overdoses.
So you're using Narcan 10 to 12 times a day, or no?
No.
Okay.
No. Very specific clinical circumstances dictate whether we use Narcan or not to use Narcan. But anybody who is deemed to have overdosed, it could be from an opioid, it could be from anything household related, or just regular medication that you see over the counter like Tylenol or Advil. Those are all fall under the category of overdoses. In terms of how many times we give Narcan a day, I can only speak for myself because that is very rough, and that comes over many, many years. I can tell you that at least once a week I administer Narcan.
So, okay. And what is one of the first signs that you look for? So you pull up,
right? You
might, or for the folks at home, what would you look for if just when someone might need Narcan, or when you think there's trouble?
Sure. So the first thing we'd do is we'd recognize a person who has what we like to call an altered mental status. Someone who isn't acting properly, someone who is maybe very sleepy or nodding off quite a bit, or someone who is completely unresponsive to, "Hey Joe, how are you doing?" So the first thing we would do is just assess that. Sir, are you okay? If we have no response, we're looking at somebody who might be in trouble. If that person stirs and is like, yeah, I'm fine, well then, we're going ahead and we're going to, help that person in another way. If this person is unresponsive at this time, the first thing we're going to do is, okay, this person's not responding to me, there's something very wrong with them, and I'm going to start the 911 system by picking up the phone and calling 911.
So you're checking to see if the person is responsive first. That's the first thing
Very
you do.
important.
So you might notice someone, maybe might look like they're sleeping.
Yes, that's exactly.
And you might want to check on that person. So you might approach that person, tap them on the shoulder, whatever you do, call their name. If they're not responding to you, you go to method 2, which is trying to wake them up.
Yes.
And again, what are some of the manners you could use?
A simple tap on the shoulder.
That's it. Okay.
If you're unfamiliar with the individual, you might want to walk up and maybe tap your boot to the bottom of their shoes. Just, sir, ma'am, are you okay? You need any help? Again, most people at that time who are well enough will respond to you by saying, yeah, I'm fine, or leave me alone, or go away. Those types of responses would indicate that individual is well.
And at this point, it's clear that the next step should be to call 911.
If they're unresponsive, sir, nothing, and you get a little bit closer, sir, still nothing, and then you know that there's definitely something wrong. We will
Okay.
want to go ahead and activate the 911 system.
Okay, so after you call 911,
Yeah, so real quick before we go too far,
Yep.
we should mention that if we're calling 911 via our cell phones, very often it goes to the state police. If it goes to the state police, please stay on the line. They're going to need to transfer you to the appropriate city or town that you are in. So that requires an additional 3 or 4 seconds, but many people will give their address and give where they are, and then they'll just be like, I need help, and hang up. Unfortunately, that you're giving the state police or a regional dispatch that information, and not the city or town that needs it.
and you could be hanging up too soon.
Much too soon.
Right.
Much too soon. Thankfully, the 911 systems actually can give you verbal instructions on how to give Narcan if you do not know how to do it. We're
Really?
gonna go ahead and cover that today. So that's one step out of the loop that we do not need to take.
Okay.
But staying on that line is going to get you a little bit more help, a little bit quicker, and a little bit more in depth.
So once you call, just stay on the line until
Please
they.
stay on the line,
Okay.
absolutely.
And you could even go as far as putting your phone maybe on speaker,
Absolutely.
like we talked about, and putting the phone down.
Yeah, so if you're by yourself, then you go ahead and dial 911, put it on speaker, and anywhere you might be, you can put it on your pocket, you can put it right down next to the patient, wherever you may be. That way you can have a conversation and still be on the line, and yet still be helping this individual.
And the other person on the other end knows exactly what's going on.
Yep, and they can
Okay.
talk to you, and you can talk to them, and you'll have that open line.
Perfect.
Any information you're going to give to them is immediately going to be given to us as the first responders.
And at that point as well, it could make the person that called feel a little bit more safer, because at this point, I'm sure it's kind of nerve-wracking when you're coming across someone who might
Terrifying.
not be breathing.
Absolutely terrifying.
Okay.
Even still towards first responders, it gets our adrenaline going a little bit. So.
Okay.
Yeah, so once we've determined that they're not responding to us, we want to check to see if they're breathing and check to see if we have a pulse. We're going to, for this demonstration, assume that we have both breathing and a pulse, but the breathing is very, very slow. I'm going to say 5 or 6 times a minute, which is very, very low.
Okay.
Okay, but we have a pulse and we are breathing. I'm going to check their pupils next. Just very gently pull back their eyes. We're going to notice that the pinpoint pupils, the black part of your eyes, are going to be very, very, very tiny. All right, that it almost in and of itself speaks towards an opioid overdose. Maybe not just an opioid overdose, but definitely opioids in the system. Something that we can help with Narcan.
Perfect.
So Narcan is a medication that is developed naturally into our bodies, okay? We can give Narcan for opioid overdoses. It only works for opioid overdoses. And when I speak about opioids, I don't just mean heroin, but I mean the medications over the counter, such as morphine, oxycodone, OxyContin, Percocets, and fentanyl.
And also, we discussed earlier, Suboxone.
Suboxone, yes.
That's another one.
Suboxone and
Okay.
methadone are given to the individuals trying to come off of heroin.
Right.
It's a medication that they slowly wean you off to prevent you from becoming what we like to call dope sick or experiencing withdrawal overdoses symptoms. Unfortunately, that's a 24-hour medication. So if someone takes too much or on purpose takes too much for the high, that overdose is just as deadly, because although we do administer Narcan, Narcan only lasts for about 90 minutes. That person will re-overdose because that medication is still in their system.
And you said it's strictly for opioids. So if the person, they could be Valium, if, someone could be taking any number of drugs.
Right.
And by administering the Narcan, you can't hurt the person
all.
anymore.
Not at all.
It
Not at all.
only works on opioids. Or, like, if I was to administer that to myself, nothing's going to happen to me.
Not at all.
So you can't hurt anyone.
I
That's
can't
what I
hurt
want
you.
everyone to understand.
Absolutely, and you can't hurt anybody of any age. So I'm going to say grandma accidentally took too much of her pain medication, or your grandson or a child gets into the medicine closet
Right.
and takes, it's not going to harm anybody of any age. So it's really helpful, and it can't do any harm.
So this is a really good tool to have
Absolutely.
as a paramedic in your tool bag, because
Yeah.
this is something right now, unfortunately, that we're all facing every day.
Every day. We've actually had this medication in our tool bag for 30 years.
And in the past 2 years,
We've used it more times than 30 years.
yeah. that's-
Unfortunately, it's terrible. But it is definitely a medication that everybody can get their hands on.
And how do you do that?
So legislation passed many years ago, about 2 years ago, stating that first responders and loved ones and people who are concerned of individuals that they know overdosing. So now you can get that at any pharmacy or over the counter. You walk up to a pharmacist and ask for some Narcan, please, and they will give it to you. Those people on Mass Health can get it for little to no cost at all,
Okay.
depending on where they are, what region they are. And of course, if you want to go via your doctor, so you have a loved one who has it as well, the loved one can get a prescription for Narcan, to which they can go to their pharmacy and fill it as well.
So let me understand. So if you walked into a Walgreens, a CVS, you could go right to the pharmacist.
Yes.
And you could ask for this, and you could get it, whether it's a copay or however it is you pay for your own.
Yes.
But would they show you how to administer it as well right there, or?
You can ask for a
You can-
consult.
okay, I
So
see.
you would generally, there's a separate little window that says pharmacist consult.
Mm-hmm.
You'd ask for a consult, and the pharmacist would come out and show you how to put together. In this case, we'll show in just a moment. Put together the Bristol jets, is what we call them, and how to administer if necessary.
Do you recommend, or do you see that this is very? I personally think that everyone should have Narcan. I think it should be in every household at this point, because we all either know somebody
Yeah.
or a family member. I think that everyone should potentially know how to use this drug and have this drug on hand in case of
Absolutely. It's basically how you feel you you never know when a loved one might accidentally take too much medication, or if a loved one got into a medicine cabinet, or there may be an individual in your family that may be addicted that you do not know about.
And it's a life-saving.
It's a life-saving, absolutely, every day we're saving lives with this, and it's to the fact that you do no harm. So it's one step that you can do and to save someone's life. And if it's not that medication that we're talking about, then you've done no harm. Can't go
Okay,
wrong.
so I have many more questions, but maybe as you go, I might interrupt you.
Please.
But let's go back to the initial person that might be needing some assistance.
Right, so we've already established this patient's unresponsive and breathing very slowly. Their skin will be very gray, their lips might be a little blue, their eyes will definitely be pinpoint. There may be evidence around that this individual has used some medication bottles. We're talking maybe some spoons and some needles. That would help us in determining this is the medication that we're going to use. So once we have said, okay, I really think this is what we're dealing with. I think we're dealing with an opioid overdose. I'm going to go ahead and get the Narcan ready. This is how it is commercially given. It's in this salmon pink package, and it's 2 milligrams. It comes attached with a little plastic bag, and in it is our atomizer.
So this is the piece that you would put on. You're going to open it and show,
Yes.
but that's the piece you put on the top.
This is the piece we put on top. What this does is this makes the medication a mist. And as a mist inside your body can break that down and use that medication even faster. So that's why this is so very important.
And that goes in the nose, in
That
the
goes
nostril.
in the nostril.
Okay.
So when we open up this package right here, we're going to pull out 2 vials. All
And
right.
that's in that package.
Yep, just like
Okay,
this.
got it.
Just like this. All right, we're going to pull off these. We're going to pull out these 2. We're going to go ahead and flip this one upside down and remove the yellow cap. And we're going to take where the colored end is. Sometimes this is blue, sometimes this is gray, and we're going to remove that cap. And we're going to bring them together and very gently twist until we cannot twist anymore.
Got it.
Okay. Once we're done, we're going to take this yellow cap off, and we're going to go ahead and attach our nasal atomizer. And that is just a simple little twist until you can't twist anymore. You're now ready to administer Narcan.
So there it is right there. That's how you put it together.
Yes.
Okay.
So then we want to approach our patient, and again, making sure we're still unresponsive. Sir, sir, sir. Still no response. Tip the head back just a little bit. All right, we're going to take this soft piece right here, and we're going to put it in one nair. And we're going to angle it kind of down, just like so. We're going to take a look at our little vial, and about half the vial is going to go in one nair, and
So
half.
you would be judging it at this point half and half.
Half and half.
Okay.
And I mean, technical terms, and I'm going to go ahead and deliver the second half. Technical terms, it would be 1 milligram in one nair and the other milligram in the other nair.
Okay.
What we're attempting to do is prevent that medication from creating little droplets. We want to keep it nice and misty. The more droplets, the slower the body is
Okay.
Okay, so once we've administered this, all right, we want to just keep monitoring our patient, keeping sure that, 911 is on, let them know that they're on
So
their
they're
way.
still on the line.
Absolutely, they're still on
Okay.
their way.
Are you doing any chest compressions, any mouth breathing? Are we doing anything at this point?
At this point, we're not, because we've determined our patient is breathing and we've determined our patient has a pulse.
Okay.
But there might be a time where a patient is not breathing or the patient does not have a pulse. In that case, we're going to be doing CPR along with the administration of
So
Narcan.
the first thing, if the patient was not breathing,
Yes.
and you've determined that they're not breathing before they're not breathing, you would call 911.
Yes.
Before administering the Narcan, is there another step? That's when you would have to
Yeah, we would.
blow some breath in through the mouth.
Yes, we would start CPR.
Okay.
We would start CPR.
Now, does the kit come with anything? Like if someone gets a Narcan kit, does it come with something that goes over the patient's mouth that for you to blow into?
It does not, but those are
Okay.
readily available for pennies, for 5 or 6 cents at the pharmacy, and it's just a little plastic shield that
Right.
will come over their mouth. So if you'd like to get one of those and just tape it on your Narcan box, it's something along with your nasal atomizer that will be along with
And
it.
then if you had nothing and it's in that moment, you could simply use your shirt. You could couldn't you put something over and blow right through?
Yeah, whatever you need to do to make a barrier, I'll be honest with you. If it's a loved one, it's a little bit more, it's a different situation.
Correct.
But
Correct.
if it's a stranger on the streets, sometimes it's safer just to do the hands-only CPR.
So you're doing the chest compressions.
Yeah. So with the chest compressions or the hands-only CPR, the good thing about that is that that's still pushing air in and out because you're pushing their chest down and you're releasing it. It's still got some passive air movement that's
So the
going
person
on.
needs air. That's what we're trying to.
Yeah.
That's what we're trying to
It-
determine.
that
This
medic-
person needs air.
That medication needs to get down into their from their nose down into the back of their mouth.
And
down
the
in-
only way that happens is by
Air.
breathing. Like it
Yes.
has to get in through air. So
Yeah.
you're pressing on the chest. You might blow into somebody's mouth. You've started CPR.
Yes.
Okay.
So once that is the medication is delivered, you can expect a change in a patient about 3 to 5 minutes. And it seems like a really long time, but it does go by rather quickly.
So you've administered it. You're doing chest compressions,
If
and
you
now
need to. Yep.
in a perfect world, you've already called 911. So the ambulance, the paramedics should be there hopefully by that time.
Yes.
But if not, if God forbid something happens and it's taking a little longer,
Yeah.
would you go ahead and administer a second dose?
If in 3 to 5 minutes there's no change in the patient and you have a second dose, I would administer a second dose,
Okay.
absolutely. So what our goal is here is to get the patient breathing again.
Right.
Very often there is a period of time or a medication where it's just enough to get that patient to breathe again. Once that patient can start breathing again, they can start overcoming the overdose. So if you've noticed in your first dose, your patient's still not waking up, but they're breathing on their own, I would not administer the second dose right away.
Right.
Wait for the EMS to arrive. If you have waited your 3 to 5 minutes and still no change and they're still not breathing on their own, you can go ahead and deliver your second dose.
Okay, so technically, I've heard some things in the past. So when someone comes out,
Okay.
when they come out of, they call it a Narcan reversal. So you've done your job, you've administered the Narcan, and that person wakes up.
Yes.
Is it true that they could be maybe not happy?
Absolutely. Unfortunately, what we're doing here is we are taking their high away. So someone who lives every day at some base level of being high, you're throwing them immediately into withdrawals, and very severe withdrawals at that. It's not uncommon for these individuals to be very angry and dope sick as a result of that.
For a person to come back, once you've entered the reversal of Narcan, just so people understand at home what's happening, a person that gets Narcan is in an overdose state from using drugs, okay? So now they're gonna bring them back. So what the Narcan does, and correct me if I'm wrong, is it brings that person, it blocks the opioid. And so now that person is no longer high. So once they come back, they're not happy, and instantly they usually want to use again?
Absolutely. If we have a rule that once we give Narcan to transport to the hospital, because the risk of these individuals trying to fix that overdose, that withdrawal symptoms, when they go to fix the withdrawal symptoms, they tend to have to use more medication. more of the heroin, more of the street medication, whatever they're using to get their high, and very often that is deadly.
So it's important that you try to keep the patient with
Yeah,
you
if
for
you
as
can.
long as you can, because 9 times out of 10 the person wants to leave.
They want to leave, they want to get out, and they absolutely want to get rid of this terrible feeling that they feel now of being dope sick. So the good rule of thumb is generally heroin in your system lasts about 2 hours as a high. Any over-the-counter medication can last 6, 8, 10 hours. We were talking about Suboxone and
Right,
methadone
right.
earlier. That can last in your system 24 hours. Unfortunately, Narcan lasts about 90 minutes in your system. So if these individuals want to get up and leave, they risk at the end of the 90 minutes not only re-overdosing because the medication is still in their body, but if they go out and try to fix the dope sick, they're going to have to use a lot more medication to feel high again. And when the Narcan stops working, they're going to overdose to a fatal level.
So should we, as the person administering the Narcan, tell this person that to try to keep them there, saying, listen, I understand how you're feeling. I know you're not feeling well and you want to use again, but if you do, like, just know that there's a potential of death or overdose again, because this in 90 minutes will wear off.
Yes.
And whatever you do before now and then, you might not get high at the initial moment, but it's going to come when the Narcan wears off.
Absolutely.
Okay.
It is very often.
Do you see that happening?
Yes, we do. And that's what is very tragic and very, it hurts us a lot, because we have helped this patient and we have brought them back to life in the simplest sense of the being, and unfortunately we haven't been able to keep them alive.
Right.
And that's a lot of where our frustrations come from, because we've worked so hard.
Mm-hmm.
And very often we can say we can lead a horse to water, we cannot make them drink.
Correct.
So by giving them the information and letting them make their own decisions, unfortunately, at some point in time, it might lead in a negative manner. But I know as an ambulance, if we are to administer Narcan, we do transport.
If they want help.
So there is a new act out there with the police departments here in the state of Massachusetts that a police officer can place an individual who has been reversed into police custody. That allows us to take them to the hospital and to help.
Oh, so you can take that person.
Yes. Yes. Once they get to the hospital, that is a bit of a different story.
So right on the street, they can't just leave it. If you reverse them, you can take them.
Not if I reverse them. No.
Oh, that's wonderful. That's wonderful news.
Yeah. So again, we're bringing them to help. We're bringing them to the hospital. We're giving them all the help that they need. When they're ready, that will be available to them. If not, unfortunately, again, we run into the same problem, that they may leave, and when they do leave, they'll use again. And the likelihood of them overdosing to a fatal level is great.
And the person, just so we can wrap this all up so it's not too much information for people to take in, the person that you've administered the Narcan to, that has came back, that you've just brought to the hospital, the last thing they remember is when they used. Now, the next thing they know, there's a bunch of people standing over them, transporting them, and they don't know what happened to them. They have no idea what's just went on. They just know they want to get out of that situation right there.
Yeah, so you have an overdose victim. Let's be honest with you. I want to use the example of heroin.
Right.
You've used heroin, and the last thing you know, you've used, and then when you wake up, you see cops all around you, and you see people who are in dark uniforms who aren't police officers but are there to help you. It's frightening. It is scary, and these people should know that. In cases such as that, the number one objective for the police department is to get this individual help. It is not to, and I'll quote an officer I spoke to, jam them up.
Yeah,
it's
right.
to get them the help. So it's frightening for them. And the calmer approach that you can take in explaining what's going on to the person, the better off they're going to be, and the more likely they are to seek help if it's available.
And that's what, Malden Overcoming Addiction is. We've just put on 5 recovery coaches.
It's amazing.
So our hopes is we're trying to put on about 20 more in the future. So our hopes is when someone like you or the fire department goes out, we're trying to build a type of program where you guys could have maybe our cards, and you could hand a card to the, almost like a lifeline.
Right.
Hey, you might want to call this number. This could save your life. Because I know that you guys can only take them so far.
Yes. Again, lead the horse to water. We can't make him drink.
And then it's up to them, you know, to go a little bit further. And I want to switch gears because I don't want to run out of time. So I see a couple of different atomizers here. And for a
Yes.
couple of minutes, can we talk about, I know that this one here, you know, they had maybe a callback on the tip of it.
Yes.
So they were bringing out this other one. We talked about this. What is this one?
So this one is the same medication. It's a little stronger dose. So instead of delivering 2 milligrams, you're going to deliver 4 milligrams. It's a smaller amount of fluid as well. It's just a more.
It looks much simpler to use.
It is. So there's a little tip on this that you're going to remove at the time. Put it right
so
up.
this comes already made.
Yep, right in a blister
You don't
pack.
have to do anything.
Nope, you just open up the little pack. Just take it away, throw it away. All you gotta do is take this, place it in one nair, and just go ahead and buttress your fingers to that person's nostril and push it till you hear a click.
That's it.
That's it, you're done. That's the medication's now been administered, and this can be thrown away. There's no glass, there's no needle, there's no nothing.
And pending on the situation, at this point, you've administered it. So if the person wasn't breathing, you would continue the CPR.
You continue.
And if the person is breathing, you would hope that they wake up.
They would wake up,
And
absolutely.
you'd wait 3 to 5 minutes
3 to 5 minutes. With this
for the
is
second dose.
no second dose with this one.
No.
This is double what you would be giving here. So instead of giving a second dose, it's just this.
And what if the person doesn't wake up, hopefully in that 3 to 5 minute time, the ambulance arrives?
Absolutely, yeah.
Because again, you want to call 911 before, once you see the patient and you administer that, the first thing you had done when you realize that the patient needs help is you call 911, then administer it.
Administer it.
Okay.
Simple as that.
And so what's the other one we have?
This one is an auto ejector. This is just like one's EpiPen. This is to be administered in a major muscle group like a thigh. As soon as you pull this, it begins to talk to you about how to administer it. You pull this. I'm going to go ahead and do it.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
I'm going to pretend that this is the outer thigh. We're just going to put a
2
small.
inches. 5, 4, 3, 2, 1.
Wow.
It's done.
Injection complete.
Unfortunately, these are far more expensive.
This
These
trainer may be reused for training purposes.
much more expensive.
Place the
Okay.
red safety
But
guard
I
on
wanted
right
to go
outer
over
case.
all of the options that were in front of me. Now, we're running out of time, but I wanted to thank you so much. This
My
was
pleasure.
so very important.
Absolutely, my pleasure.
And what I want to do now is I just want to let everybody know that if you know somebody that needs help, if it's you, if it's somebody else, please contact Malden Overcoming Addiction. You can go to our Facebook page, Malden Overcoming Addiction, at Facebook. On Twitter, we're at Malden Overcomes. Our email is maldenovercomingaddiction.com. We're here for you, and we can be very discreet, but please, if you need help, please call us. And again, thanks for watching, and we'll see you next month.